Hi everyone. In this video, we'll break down the key findings of Fibroneer IPF trial. So we'll look after a drug beyond pirfenidone and nintedanib, which has come up in IPF and PPF. We already know pirfenidone and nintedanib, they do not halt the disease progression and they have their own side effects, including GIT being the most. Multiple trials, multiple landmark trials related to pirfenidone and nintedanib available capacity as in impulses tomorrow in journey and senescence trial. But recently, we come across Nerandomilast in May 2025, which is a new oral drug, preferably a PDE4B inhibitor, and it has both antifibrotic and immunomodulatory effect. It is in phase 2 trial and it involved patient with IPF in this Fibroneer IPF trial. So again, phase 3 multinational double-blind randomized control trial, which enrolled around 1100 adults above 40 years of age with a diagnosis of IPF. They were randomized into 3 groups, each group carrying almost equal number of sample size, around 392 and 3. And one group was given Nerandomilast 18 mg orally twice daily. One group was given 9 mg twice daily, and one group was given placebo twice daily. Approximately 3/4 of the participants, they used the background antifibrotic therapy, that is pirfenidone and nintedanib. So the primary endpoint they look after is the lung function decline at 52 weeks. So Nerandomilast 18 mg VD group had a decline of FVC around 114.7 ml, that is 115 ml mentioned here. The one with the 9 mg had a fall in FVC at week 52 of around 139 ml. The placebo group has the major fall, that is 184 ml. So yes, Nerandomilast helped preserve lung function better than the placebo and more commonly at the higher dose. So, but it did not significantly reduce time to first acute exacerbation, respiratory hospitalization, or death. Also, the patient reported outcomes of dyspnea, cough, and fatigue, they were almost similar across all the groups. They also saw that co-administration with pirfenidone resulted in lower nerandomilast plasma levels, so suggesting a drug-to-drug interaction, which is something to watch out, especially with pirfenidone. Diarrhea was the most common side effect seen in more commonly in the 18 mg group as compared to 16% in placebo. Otherwise, there was no serious threat. So maybe Nerandomilast is not a game changer here yet, but lung function preservation itself is meaningful. So there are 2 trials, Fibroneer IPF and Fibroneer ILD trials, done in IPF and PPF patients, showing promise results. That is it for today's breakdown of Fibroneer IPF trial. If you found this helpful, don't forget to like, share, and subscribe to Breath Hackers. Obviously, your go-to channel for all the things pulmonary. Thank you.